All right. Welcome, 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 my friends, to another episode of Extreme Health Radio. Really excited about this show. This is going to be an awesome show. We're going to talk about ozone with the father of ozone, Dr. Frank Shallenberger. We're going to talk about its benefits, its applications, and all that good stuff. So stay tuned for that. We'll introduce him in just a second. Super excited you're here. This is going to be a great show, and this is episode 656. Can you believe? I cannot believe it sometimes. 656 shows we've done. Unbelievable. So if you guys are listening on iTunes in the future or at any point and you want to grab the show notes, just go to extremehealthradio.com, and all you got to remember is //656. So that will be, everything will be available there. Sponsors, guest websites, links that we talk about, all that good stuff will be available there. I hope you guys are having a great day wherever you are in the world. And if you're sort of unfamiliar with our show, we broadcast 3 days a week live on YouTube, and then we release a podcast every single day on iTunes. So if you haven't subscribed on iTunes, on Stitcher, on whatever else, YouTube, all that good stuff, make sure to subscribe, because there's some really good content that we're producing every single week with some great people. So today we have Dr. Frank Shallenberger. We're going to talk about ozone therapy, oxygen metabolism, aging, disease, and all that fun stuff. And then on Monday, we have Dave Feldman. We'll be talking about cholesterol and the low-carb diet. And then we have Dr. Ibrahim Jaffe again? Wow. Okay, February 13th. We had him on just recently, and that was a really great show, all about spiritual, mental health and things like that, and that was really great. And then next Friday, we have Brendan Marotta, and he has a documentary, interesting documentary called American Circumcision. And he's the director and the creator of that. So that'll be an interesting show with 2 7-month-old twin boys. That is a little bit interesting to me. So that'll be next Friday, a week from today. So stay tuned for that show. And let me bring up Dr. Frank Shallenberger. So I was reading his bio, and my goodness, since he's been in practice since 1973. That means he went to medical school well before that, but he's been practicing for 46 years. And he is known as the father of anti-aging medicine, as well as ozone therapy. And he also has he's a developer of Prolozone, which is an injection technique that has been shown to regenerate damaged joints, herniated discs, and degenerated joints, tendons, and soft tissues. And he has just published his first paper on Prolozone Therapy a while back, actually. This is sort of an older bio, but he's also the author of a bunch of different books. Let's see, he's written 2 books, the Type 2 Diabetes Breakthrough, as well as Bursting with Energy. And I had Prolozone years ago on my knee when I tore my ACL. So this is going to be a really great show. Let me bring him up into the show. Dr. Shallenberger, thanks for joining us.
Hey, it's great to be with you, Justin.
Yeah. So I was reading your bio, and 1973, you started in practice 2 years before I was born. Amazing.
Yeah. It moved by pretty quickly, I have to say.
Yeah. So when I was reading through and learning more about your background and career and things, what got you started in ozone? And because you started out right as a traditional medical doctor, and then now you're doing a sort of integrative approach, right?
It's an interesting deal. But when I went to medical school, I imagine they're still teaching the same thing.
Mm-hmm.
But back when I went to medical school, everybody recognizes how important oxygen is. It's obviously the most important thing you can do is breathe. So we all know how important oxygen is. But in medical school, they teach you that as long as you're breathing the oxygen in, everything's fine. And as long as you're delivering the oxygen. So if you don't have lung disease, if you don't have heart disease, for example, everything's fine now with oxygen. It just turns out that is not true, because there's another aspect to it. One is about getting the oxygen into the body, but the other aspect is using it. Because what that oxygen does when it gets into your body, it goes to each and every one of your cells. Basically, your cells use the oxygen to keep the cell alive, to allow it to do all the things that it does, and so forth and so on. And to the degree that the cell can process the oxygen efficiently, it gets all the energy it needs, and everything's just fine. The problem is that for many of us, we can have very decent levels of oxygen in our body, but we're using it poorly. That's the genesis of aging, and pretty much all the diseases as we get older is an inability to process oxygen properly. And what's really particularly onerous about this situation is modern medicine completely ignores this, utterly ignores it. We know it exists. It's all published data, but medicine just ignores it. They're going to check your oxygen level. If your oxygen level is okay, adios, see you later, it's okay. They never, virtually never, check to see if you're actually using the oxygen in an efficient way.
Yeah. So in what ways is the body not utilizing oxygen properly? Then where's the breakdown there?
So the understanding is this. The oxygen that you breathe in, it only has one purpose, by the way. And that is it's going to find its way down into your cells. And in your cells, it's going to get taken up by these little bubble-like structures called mitochondria. Each cell has in the order of 3,000-4,000 mitochondria. If you look at any given cell, almost half that cell consists of mitochondria. So in a way, you can kind of think of cells as consisting of two parts. One is the mitochondrial part. That's where the oxygen goes. And in the process in the mitochondria, the oxygen is converted to energy.
Okay.
And then that energy leaves the mitochondria, goes out into the other half of the cell, which then uses that energy to do whatever that cell's going to do. Whether it's a brain cell, an immune cell, a kidney cell, it doesn't much matter. Yeah, every cell does something. And so that cells have two parts. One part is the part that processes the oxygen into energy, and the other part is the part that uses that energy to keep us alive. The interesting thing, Justin, about people as we get older is the part of the cell that uses the energy stays pretty much intact until you get maybe into your late 90s.
Really?
And then it starts falling apart. Now, there's going to be some variations on this. Some people are going to have genetic diseases and so forth and so on. But for ordinary, everyday people, the part of your cell that uses the energy to do whatever it does, brain cell or whatever, works really good. The problem is not that the cells go bad. The problem is that the metabolism goes bad. The part of the cell that processes the oxygen into energy, that becomes inefficient. So that the other part, which could work pretty well if it had enough energy, is not going to work very well because it's getting deprived of energy. And in essence, human beings, as we become older, sort of become like a really good flashlight with a battery that's fading.
Yeah. So when it comes to that, is that because the oxygen has to sort of pass through and be utilized by the mitochondria, and it's the poor mitochondrial function that can't process the oxygen, and then the cell can't use it?
Yeah, that's absolutely right.
Interesting.
The oxygen's there. It's going to get into the mitochondria, and the mitochondria is going to basically say, sorry, I can't, you just gave me 10 oxygen molecules. Right now, I can only process 5. Too bad.
And so what actually happens to the other 5 oxygen molecules then?
Good question. They don't get wasted. Turns out the other 5 molecules now are going to get converted into what we call free radical molecules. If the oxygen cannot get processed in the mitochondria into energy, it also goes into free radical production. And so if that energy system is blocked, the free radical production is going to increase. And probably by now, most people know that that's what causes disease. As you get older, it causes the breakdown in the body. As you get older, it's this excessive free radical production. But what they don't know is that the cause of that excessive free radical production is an inefficiency, an inefficient ability to process the oxygen into energy.
Okay, so it would seem to me that you would want to make sure that your mitochondrial function is operating properly before you would begin some sort of oxidative therapy. Would that make sense?
Well, it's not quite as simple as that. I see what you're saying. That does make sense, and of course that's important. If you're just doing an oxygen treatment, and I'm thinking of like either just breathing oxygen or hyperbaric oxygen or something like this, and you're not processing it well, that could actually be a problem for you.
Okay.
So in medicine, they teach us that oxygen is potentially toxic, and it's going to be more toxic to people who are unable to process it efficiently.
So we have this oxygen coming in to most people through breathing and through otherwise, and it's coming into the body, but their mitochondrial function is suboptimal, so it's not able to process. So let's say the example you gave, 10 oxygen molecules come in, your mitochondria is healthy enough to be able to sort of satisfy 5 of those and utilize 5 for usage. So then the other 5 are going to go off and create oxidative damage and oxidative stress. So that's what it sounds like is what's happening. Is it a type of thing where through the continual use of oxygen, you can actually use oxygen as a way to boost mitochondrial function and get that part working correctly?
Well, so what happens is that sorry about that.
No worries.
What happens is that as we fail, as the mitochondria go bad, and this happens with age, the more birthdays you have, the less efficient your mitochondria are. That's a fact. Now, we can do things about it, and that's where ozone comes in.
Okay.
But ultimately, the more birthdays a person have, in a very linear and predictive fashion, the mitochondria work less efficiently. And as you pointed out, there's two problems with this. One is less energy to the cell. It can't work as well. And 2 is it has much more free radical damage to deal with. And ultimately, what we just talked about is really why you can't live forever. Because ultimately, you're not going to be able to process the oxygen, and the free radicals is going to become so strong that that's going to bring about your final demise. However, it's obvious at this point, probably to most people, that the more efficiently you can keep those mitochondria processing oxygen, the longer and the better quality of life you're going to have.
So really, it's all about mitochondrial function and making sure
it's
that
not
works.
So much about oxygen. For some people, they have chronic lung disease. A lot of people have circulatory issues. They can't deliver the oxygen to the cell. Those are important issues. But the biggest issue, and the one that's totally ignored by medicine, this is the problem. Medicine knows if you got chronic lung disease. Medicine knows if you got, if you're in heart failure, if you have some kind of circulatory problem. But medicine completely ignores the most important problem, and that is the inefficiency of the mitochondria. And that's where ozone comes to play mostly. It also hits some other areas, but it improves the way your mitochondria process oxygen.
That's so interesting. Okay, so from before you said we have about 3,000 roughly. I've heard up to 10,000 mitochondria in your brain and heart, but let's say 5,000 on average, 3 to 5,000. And then you have like 100 trillion cells. So you can imagine, that is an insane amount of mitochondria that you have in your body. Yeah.
And I make a good point there. When you talk about the brain having so many more mitochondria, the brain is even though it's a very small part of the human body, utilizes more than half of all the oxygen you're breathing in.
Really?
Yeah, and that's in a resting state. So for us right now, our brains are using more than half. So it's a little teeny area, but because it's so many huge mitochondria in the brain, that's where most of the oxygen gets used. So what do you think is going to happen as your inefficiency with oxygen increases? One of the first things to go is your brain function.
Yeah, that's so interesting. Wow. So you said it utilizes about half of the oxygen that we take in.
Yeah, in a resting state. Now, if you and I get up and start exercising, now the heart and the muscles are going to start using more and more of that oxygen progressively. But for most people, when they're not exercising, that's where most of the oxygen is going to be used.
So let's talk a little bit about ozone. Like, what is ozone? That's, a big part of your
Okay.
work, obviously. What is ozone and how does it affect the body? And we'll talk later about different uses and things, but let's just sort of start from scratch and talk a little bit about what it does and how it enters the body and what it does inside the body.
Yeah. So ozone's quite fascinating. Now, there's ozone in the pollution, right? Everybody's heard about ozone in the atmosphere. That's different than what we're going to be talking about. Everybody should know that we're talking about medical grade ozone.
Okay.
Medical grade ozone is pure oxygen. And the way you make it is it's basically 3 oxygen atoms together. Okay. That's ozone. Mm-hmm. Regular oxygen, the oxygen that we're breathing right now, is 2 oxygen atoms together.
Okay.
Turns out that in nature, you can't have just 1 oxygen atom. There's not enough electrons in 1 oxygen atom for it to actually exist in nature. Okay. What it does is it combines up with another oxygen atom, and you got 2 of these oxygen atoms. And what they do is they stick together because they're sharing electrons. That's the force that holds them together. Okay. So because of this electron sharing aspect to oxygen, pure regular oxygen, which we call O2, because of this electron sharing aspect of it, it's a pretty stable molecule. It stays, it doesn't really, it reacts, but very, very slowly. Okay. Whereas ozone, what you do is you take this oxygen, this medical oxygen, you buy it in a tank, for example, you run it through a converter box. And what the converter box is going to do is going to break the ozone, the 2 ozone couples up into single O's, okay. Single oxygens. And then almost instantaneously, those oxygens are going to go back together to form O2. Okay. But approximately 2 to 3% of them are going to go back together as a triplet and form O3. So, and that's ozone. Okay. So it's pure oxygen. It's 3 oxygen atoms. And here's the deal. You've got 3 oxygen atoms sharing the amount of electrons that makes 2 oxygen atoms stable. Okay. Nature doesn't go for instability. So it wants to stabilize. So what it's very quickly going to do is get rid of that 3rd oxygen atom. Very quickly. So and by quickly, I mean this. When I take ozone and inject it into people, and we can talk about all the ways you can do that, but when I do that, the ozone's gone in a heartbeat. Instantaneously, it reacts. Okay. Now, oxygen doesn't do that. If I were to just put oxygen in your body, it's just going to sit there and very slowly get utilized. But ozone is so much more powerful than regular oxygen that it can be used to stimulate all kinds of things that you can't normally stimulate by just breathing or just getting exercise, for example.
So doesn't it seem like a pretty poor, I don't know what the right word is, not utilization, but you said like 2 to 3% is only converted. And why does that happen? Why isn't it a higher percentage, do you think?
Yeah, because that's a good question. Probably by the time it comes out of the box, you can make a very higher concentration, but for medical reasons, we only want like that 2 or 3% because much higher concentration like that turns out to be too toxic. Okay. So you make that adjustment.
So now you have this oxygen in the body that reacts instantaneously. So what's going on at that point inside the body?
Okay, so what it does is as soon as it gets in the body, it's going to instantaneously react with a fat molecule, or what we call a lipid molecule. Lipid molecules have what they call double bonds. For all the chemists out there, and double bonds can be oxidized by ozone extremely quickly and efficiently. Okay. And that's what it does. It reacts with all the double bonds in lipids, and it forms what we call fat-soluble or lipid peroxides. Okay. And these lipid peroxides, those are the things that actually perform all the things that we're going to talk about. That when we say ozone does it, technically speaking, ozone doesn't do these things. Technically speaking, what ozone does is it forms these peroxides, and then these peroxides are what do everything.
Oh, okay. So
And they can last in the body for weeks, by the way.
these lipid peroxides can.
Yeah.
Okay, so what they do is they interact with these lipid. Do they make lipid peroxides, or they actually interact with them?
So now you've got these lipid peroxides in the body, and these lipid peroxides stimulate oxygen metabolism. That's one thing they do.
Okay.
So we just talked about how inefficiently the mitochondria are. These lipid peroxides make them more efficient. Create certain changes. For the technical people in the audience, it alters what we call the NAD/NADH ratio, such that the mitochondria are way more effective and much more efficient.
So now the mitochondria can actually work with the oxygen and better utilize
Yeah.
it, so that the cell can use it.
So if you take somebody, for example, to use our previous thinking, if you got your 10 molecules of oxygen and you can only utilize 5 to produce energy, after a series of ozone treatments, you'll be utilizing 7 or 8, or maybe all 10.
Really? And then after a series of ozone treatments, can you stay at that all 10 level? Does that stay with you?
You know, the aging process itself wants to make that less efficient. The older you are, the more effective it is at doing that. So the answer is, yeah, you can get yourself a series of ozone treatments, and you'll be utilizing oxygen a lot better. But once you stop, over time, you're going to start sliding down again. If you're older.
Okay.
If you're younger, that's a different situation. But if you're older, you're going to see that.
It's interesting that the lipid peroxidase exists in the body for, what did you say, 2 to 3 weeks?
I want to say 10 days to 3 weeks, and it's going to vary from individual to individual, but a fairly long time, which is important to understand, because most of the time when doctors are using ozone therapy, they're doing it at least once a week, sometimes twice a week, and sometimes even every day.
Interesting.
So if you're doing it like twice a week, for example, the lipid peroxides are going to build up over time and going to have a greater effect.
So is the lipid peroxidase the basis upon which we get most of our sort of treatment guidelines and how often you should use ozone therapy? Is that based on the lipid peroxidase?
You know, a lot of ozone therapy, first of all, is it goes all the way back almost 150 years ago. The clinical use of ozone in medicine is not a new thing. It was used quite extensively in the early 1900s. You know who's into ozone big time was Tesla, for example.
Really?
Also von Siemens, the guy that invented the Röntgen cell, the X-ray electrodes that Röntgen used.
Oh, is that right?
And was considered the father of electrical engineering, German, back in the mid 1800s. All of these famous people knew and used ozone. And in the early part of the 19th century, it was used commonly in medicine. When FDA and things started changing in the 40s, and the American Medical Association and the Flexner Report and everything, modern medicine started to take over. And we started becoming much more interested in profit than they were in results. Ozone therapy pretty much fell out of favor, but it does go way the heck back. So what these doses that doctors now know about, and these doses that we use, they're mostly doses that were just used by clinicians over the last 150 years, and by trial and error, we know what works and we know what doesn't work.
That's so fascinating. It's been around for so long, and I'm curious, Doc, with you personally, being a medical doctor, how are you able to do what you're doing and keep your medical doctor? When I was doing research on you, you came up on a very, very, it's almost like a badge of honor, a website that I make sure all of our guests are on Quack Watch before I talk to them,
I am on Quack Watch?
I think you are, yeah. And it's just so hilarious to me that they do that. But I'm curious, with your own practice, how are you able to do the things you're doing and still being in the U.S.?
I think that the medical system is a lot more easily recognizing the alternative use of things now than it was, say, 20, 30 years ago when I first got into this. So I think as long as you're responsible with it, I like to tell all my doctors, I train thousands of doctors every year, but I like to tell my doctors that ozone therapy it can be, but you don't typically want to consider it as an alternative to regular medicine.
Hmm.
What you want to do is you want to consider it primarily as an adjunct to regular medicine, because the reality is, no matter what the kind of the doctor it is, whether it's a pulmonary doctor or heart doctor or an infectious disease doctor, doesn't matter. Whatever they do is going to be enhanced greatly by adding ozone therapy to it.
Hmm. And I have to put myself in this situation of a listener. And if I were a listener, my first thought would be, are there any major contraindications specifically with different, perhaps lung disorders or anything that would be a cause for concern for someone to integrate this into a traditional practice?
Well, there's a couple of things we need to be aware of. One of them has to do with just the dose. And
Okay.
you kind of pointed this out a little bit earlier, and that is, if you have somebody that really can hardly handle oxygen at all, is very inefficient at handling oxygen. Maybe they're quite old, or maybe they have some bad disease or something like that.
Hmm.
You can't go and give them a big dose of it. You've got to give them a smaller dose. So you've got to be able to learn the parameters of dosing that doctors know about, that are fluent in ozone therapy. The other thing is that there are certain kind of conditions where the patient can't actually tolerate ozone therapy very well.
Oh,
And
really?
those are certain genetically inborn conditions. One's called a G6pd deficiency, which is not real common.
Hmm.
But if the patient has that particular deficiency, we have to be kind of careful.
Hmm.
Another one is you can't breathe ozone.
Hmm.
Interestingly enough, I can inject it into your cerebral spinal fluid. I can inject it into your stomach, your vagina, your bladder. I can inject it into your knee, your hip, your shoulder. I can put it behind your eyeball. I can inject it into your sinuses, but I can't let you breathe it. I can put it any place in your body except your lungs. Your lungs just can't handle it.
Yeah.
So yes, you just got to make provisions so that people aren't sitting there breathing it.
Yeah. That's a tricky situation for a lot of people that drink ozonated water, right? You got to be careful how you do that, right?
Yeah, once you ozonate it, there's still a little cloud of ozone vapor on the top, and if you inadvertently inhale that, you are going to cough your butt off for
Yeah.
about an hour and a half or something.
Yeah, we're talking about a mutual friend of ours before we started broadcasting, Dr. Stuart Nunley, and he's got a
Mm.
really amazing dental practice out in Marble Falls, Texas, and he's using ozone in his practice. And I just got some work done with him a couple weeks ago, and ozone was used, and it's being used in a lot of different ways, isn't it?
Yeah, the dental use of ozone is extremely important. I think it's so important that, although I have a dentist locally here who does not use ozone, I only use that dentist for, more or less like dental cleaning and inspections and examinations and such. If I ever actually have to have anything done to me, a tooth pulled, any kind of dental procedure, I'm going to drive 5 hours away where there's a guy who's fluent in ozone. Dr. Nunley is one of the best in the whole country, but there are quite a few really good dentists in the country that know how to use ozone. So I encourage our listeners, if it ever comes to the point you need implants or teeth removed or root canals or whatever your dentist is telling you need, some kind of serious sort of procedure, if
Hmm.
you have an infected tooth or whatever, do not waste your time with a conventional dentist. Go find one who's trained in ozone therapy and utilize that. Your results are always going to be better that way.
Yeah, I completely and totally agree. And we're going to take a little bit of a break right now, but we have an interesting question that I think maybe we'll tackle when we get back from the break from Fruits and Veggies in the chat room. And he or she says, a lot of people say never to mix antioxidants with ozone therapy, because it stops the ozone from being effective. So we'll tackle that at the end of the break. Interesting question. I hope you guys are enjoying the show with Dr. Frank Shallenberger. If you guys want to get access to the show notes and anything like that, if you're listening on a podcast, just go to extremehealthradio.com/656. And one of the things I wanted to tell you guys about was I'm really looking forward to this today. We're actually getting some brand new straps for my Bellicon rebounder. They will be arriving today. We've been waiting for them for quite some time and really excited about getting my new straps here. But I've been a fan of rebounding for, gosh, it's got to be at least 10 years now, at least. And, I like to work out in the gym. I like to go hiking. I like to surf. I like to lift weights and do jiu-jitsu and do all this kind of stuff. And when I first learned about rebounding, I thought, this is just crazy, jumping up and down on a mini trampoline. That's something like Jane Fonda used to do, right, back in the 70s with the leg warmers. But when you learn more about what it does, it's really a tremendous, tremendous exercise, and it's really incredible for lymphatic system, for improving circulation, for cleansing the lymphatic system and improving bone density. We had Ty Bollinger on the show a while back, and check out what he had to say about rebounding specifically.
What do you do to treat cancer? What do you do to prevent it? Rebounding is something that I try to do on a daily basis. A little mini trampoline for those people that aren't familiar with the term rebounding, but it's basically just jumping up and down on that little mini tramp. What that does is it stimulates the lymphatic system. Lymphatic system is one of our primary detoxification systems in our body, and most folks don't stimulate their lymph flow, and so the toxicity in their body builds up because their lymph is not stimulated, and the up-down motion on a rebounder stimulates the lymph flow better than just about any other exercise. So I do that almost on a daily, probably 5 days a week. I would say I average doing that.
Yeah, same with me. I do mine about 5 to 6 days a week. It's just a really great exercise to do, and I highly recommend it. Here's something a friend of the show, Dr. Lloyd Jenkins, who runs the Budwiq Clinic, I can say that, what he had to say about jumping up and down.
On the flip side of that, you have to have some sort of a way of mitigating the stress that's in our life, right? So you have to have some kind of exercise. What kind of exercises do you recommend there at the Budwiq Center?
Well, every room is equipped with a rebounder or a mini trampoline. So we really believe in the little mini trampoline. I noticed you're advertising that just recently on your program. We feel that's one of the safest, most gentle and effective lymphatic cleansing things that people can do. They're not expensive really, and they can just do a few minutes, maybe 2 or 3 times a day. So lymphatic drainage using the rebounder is very important. Someone who has advanced cancer, we just have them mostly do the trampoline, and they can even sit on the trampoline if they have to and bounce up and down, but some kind of exercise to keep the lymph system moving, and so that they don't just, because if you don't do anything, your body just wears out. The body has to work, the heart has to pump.
Sure does. And big fan of rebounder. So if you guys are interested in getting a rebounder, we like the Bellicon for a lot of different reasons. They're built to last. You can fold the legs. They have little bars that you can hold on to in case you feel like your balance is a little bit off. They're silent. Like if you're looking here, you can look at, they use these little flexi ropes. And so you can do it when your kids are asleep. And it's just a really, really tremendous exercise that I'm just such a big fan of. And I like to do it outdoors, getting fresh air and biophotons from the sun and all of that. So Bellicon rebounder is the #1 rebounder in my opinion. So if you guys want to check it out, if you guys are watching on YouTube, there's a link down in the description. If you're listening on iTunes in the future, you can get these at extremehealthradio.com/656. And then something else I wanted to show you guys too, which is a great company that we love promoting, and that is our buddy Daniel Vitalis over at Surthrival, and he's got really great reishi tincture, and he works a lot with chaga and reishi mushrooms. And let me play this little clip for you.
Scientific research is just now catching up to what we've known about reishi for centuries. This medicinal mushroom is a wellspring of immunity. A significant portion of our immune function is influenced by external factors like our environment, diet, and history of infections. Reishi is scientifically celebrated for its ability to stimulate compromised immune systems and reverse inflammation by promoting the development of white blood cells. In addition to its immune-boosting properties, reishi is a potent adaptogen that supports a healthy heart and circulatory system. Surthrival's dual extraction process concentrates all these benefits into every bottle. We use organically grown reishi, organic grape alcohol, and bottle our extracts in violet glass for maximum potency.
Yeah, big fan of the reishi and chaga mushrooms that Daniel Vitalis puts together. I just love all of his products. You know, I love their colostrum, which is a little spot I'll play right now. Great guy doing awesome stuff. We've had him on the show a number of different times, and we actually have another bottle of colostrum coming in the next, I think by Monday it's going to arrive at our house. And check out their colostrum product. It's really, really something that you should look at.
Forget superfoods. Colostrum is mammals' first food. Containing the essential building blocks for growth, gut integrity, and immune health. Often referred to as liquid gold, colostrum is known to balance immune function, support digestive health, and increase endurance and lean muscle mass. Colostrum's naturally balanced and living nutrition, which supplies growth and immune factors, is a delicious dose of restoration that's easy to use in powder or capsule form. Clean, conscientious, tested antibiotic-free, and produced in a U.S. GMP certified facility, it's your first food for second chances.
Yes, colostrum, something we take almost on a daily basis. Good stuff. And I highly recommend, if you haven't tried out those reishi or chaga mushrooms and or the colostrum, go over to our link. If you're watching on YouTube, there's down in the description down below for the chaga, for the reishi, for the colostrum. Good stuff. Just really, really good stuff. And big fan of supporting good products and good people doing good work. And so let me bring Dr. Shallenberger back on, and let's see if we can't tackle that question from Fruits and Veggies about, let's see here. She says here, a lot of people say to never mix antioxidants with ozone therapy because it stops the ozone from being effective. So let me bring Dr. Shallenberger. So Doc, what do you think about that? Should people mix up the antioxidants and the ozone and do it at different parts of the day, do you think?
When you're putting the ozone in the blood, and that's sort of one of the major treatments we do. We do a blood treatment.
Okay.
So we'll take blood out of the body, we'll ozonate the blood, and then we'll run that ozonated blood. Now, keep in mind, what's in that blood now is a big old bag full of lipid peroxides.
Okay.
The ozone's literally gone. So we're basically running now a bunch of lipid peroxides back into the body. That's going to circulate around through the bloodstream. If you take a bunch of antioxidants before you do that, like vitamin C, for example, and your blood's loaded with vitamin C, what's going to happen is when you put the ozone in with the blood, it's going to react more with the vitamin C than it would with the lipids. And that vitamin C will decrease the activity of the production of lipoperoxide. So you don't actually want antioxidants before you have the exposure to ozone. You can have it immediately after because you've already formed the lipid peroxides by then, but not before.
Oh, okay. So if you wanted to do an ozone treatment and you wanted to do some IV vitamin C therapy or something like that, you could do it a couple hours after and that would be okay.
Yeah, we actually do it immediately after.
Oh,
so
really?
We'll give somebody a blood treatment with ozone, and then instantly, right afterwards, we can give them glutathione, we can give them vitamin C or whatever we want to give them. Because at that point, the lipid peroxides are already formed, and they're already running around doing their thing.
Oh, that's interesting. So it wouldn't make sense to me that would be the case. Just it would seem like they would have to be in the body. But I guess, like you said, if the lipoperoxides are in the body for 2 to 3 weeks, then if what I'm thinking is correct, you'd have to wait that long to have some kind of antioxidant. But it makes sense what you're saying.
It used to be thought that what she said was true. Mm-hmm. That you should completely deprive yourself of antioxidants while you're getting ozone therapy. But on the face, that's kind of stupid anyway. And the reality is that these treatments actually work better if you follow them with an antioxidant.
Oh, really? Okay.
Yeah, they work better now. We've discovered that, say, over the last 2-3 years.
Isn't that interesting? How much better?
It's hard to say. We just get better results.
Better
Put to you
results.
that way.
Interesting. So ozone, is it something, do you think people should be working with a few times a year on an ongoing basis? What kind of, how should people think about possibly integrating ozone into their life, do you think?
Well, okay. So the first thing I want to tell people is from an early age, start eating correctly. Lose all the bad habits with eating. Similarly with your lifestyle, have a lifestyle where you're not using Roundup, you're not, staying up until 2 a.m. You're having good lifestyle sorts of habits. You're not drinking too much, taking drugs, et cetera, et cetera. So
Okay.
start with the basics, but somewhere around the age of say 40-ish, 45-ish, 50-ish, your mitochondria are going to start losing efficiency. Now, you can prevent that to a large extent with an efficient exercise routine. But at some point, things aren't going to be quite right. I can pretty much promise you. I don't know when that's going to be. For some, it could be when they're 55. For some, maybe not until they're 75. But there'll be a point at which, you can see your mitochondrial function fail. Certainly, that's going to happen if you actually get sick.
Okay.
So if you have heart disease or lung disease or cancer or whatever you have, I pretty much promise you, your mitochondria aren't working anyway. In our clinic, Justin, we always test everybody's mitochondria. So if they test out great, that they don't need anything. They're good to go.
Okay.
Many of my patients do, and I just tell them, listen, just keep on doing what you're doing. Between your lifestyle and your exercise and whatever supplements you may be taking or whatever the deal is, you're doing just fine. So keep that up. But a lot of my patients, they think their mitochondria are working well, they feel well, but in fact, there's a problem. So for them, and certainly for any of my patients who are actually sick with something, ozone therapy is sort of a must. That's the big way you're going to break through them.
Interesting. So most people, or some people, can actually feel okay. Maybe they have enough energy, they feel like they have enough energy, but you test their mitochondria and it's just not working right.
Yeah, I mean, what you do is you talk to a 65-year-old guy and say, how do you feel? And he says, I feel great.
Yeah.
I say, okay, now tell me, how do you function now compared to when you were 35? And he'll say, oh, nowhere near as well.
Yeah.
And so the loss that we have comes on so slowly that we don't really pay much attention to it.
I see.
You can measure it. We published a study not long ago where we measured the mitochondrial health of a group of, I think there were 30 individuals between the ages of 30 and 40 years old, so young people.
Okay.
And they were all basically healthy, nothing wrong with them. And something like about 10% of them already had deficient mitochondrial function.
Really?
Now, they would have never known.
Mm.
They wouldn't. And most people who have deficient mitochondrial function aren't really they might complain of fatigue. They might, say, what, my exercise endurance isn't quite what it used to be. Stuff like that. But they're not going to, immediately say, well, my mitochondria are off. They're not going to get that.
Yeah.
You actually have to test your mitochondria to see where you're at.
And how long have we been able to test the mitochondria like this?
It's not commonly done, unfortunately. It's one of my passions. About 12 years ago, I developed a system whereby you can measure mitochondrial function using what's called VO2 analysis.
Okay.
And since then, I've been doing it every day. I've gotten a few of these systems to some of the doctors around the world, but very few, almost no doctors actually test mitochondrial function. It's surprising to me because every anti-aging expert in the world will tell you that mitochondrial function is at the heart of what keeps us healthy, and yet none of them test it.
And
there's only one reliable test for it, and that's this VO test that I developed.
That's incredible. So
it's pretty crazy.
How accurate is the test, do you think?
Extremely accurate. What we do is we take a mask, kind of like a scuba mask, and you're breathing through that mask. Okay. And that mask is now connected to a measuring device that's going to measure how much oxygen your body's taking in and how much carbon dioxide your body's putting out. And by looking at that, those two things, the amount of oxygen you can process and relating that to the amount of carbon dioxide you make, we can tell you how efficient your mitochondria are. Because the less efficient your mitochondria are, the less efficient oxygen you can consume and the more carbon dioxide you produce. And by measuring those, so I can tell you exactly where you stand.
Wow, that's interesting. So you probably measure on yourself quite often.
I do, yeah.
Yeah. That's
I've got some good stories to tell you there.
Yeah, well, tell us one. I'm curious.
Well, okay, so back in my early days, and I mean mostly in my 40s and before, I used to race bicycles, and I spent a tremendous amount of time exercising and doing what I needed to do to try and get in the top 10 or at least, or sometimes win. And starting around my late 50s, my late 40s, I decided I don't want to do that anymore. But when I was doing it, I was in pretty amazing shape. I could ride bicycles up mountains very quickly. And so by the time I hit about 55-ish, 56-ish, that's when I started to develop this oxygen measuring device, this mitochondrial measuring device. And I measured myself, and I was pretty good. But somewhere when I hit 64, 65, all of a sudden over that year, it dropped substantially.
Really?
And I up until then, I basically checked myself once a year, which is what I recommend people do. They should check their mitochondrial function. Certainly if they're over 60-ish, should check it every year probably. It just dropped. And looking back on it, I had to say, you know what, I was stressing out too much. I was drinking too much. I was not really behaving myself in the way I had, wasn't exercising as much. And by the way, I had posted a few more birthdays. And apparently all that added up and gave me a really low number. Wow. So a little tap on my shoulder said, okay, you know what, things are going wrong here. So I turned that around, and now I have, even at the age of 72, I have really good mitochondrial. I got the mitochondrial function basically of the average typical 32-year-old person, even though I'm 40 years older than that.
So
and it can be done. I have patients in their 80s that have very youthful mitochondrial function.
Wow. So you were able to actually reverse whatever happened in your 64th year. You were able to reverse that.
Oh yeah. It wasn't that hard. It's just a matter of doing some of these very basic things that most people are supposed to be doing, but surprisingly enough, a lot of people, they get over the age of 50, 55-ish and sort of think the game's over, and they don't make the adjustments that are necessary.
So you mentioned a while back, I was just going to ask you about some lifestyle practices that could enhance mitochondrial function and improve that. And you mentioned exercise, and like during the break, I was talking about the rebounding and things. And what are your thoughts on those rebounders kind of jumping up and down like that? Do you think those are good?
Any form of exercise is going to be good, right? But what we want to do is we want to do aerobic exercise, which means you're going to do it in form of intervals.
Okay.
I've never actually used a trampoline like that. I know a lot of people do. And so I don't know if you could really effectively do an interval training on a trampoline. But if you could, basically it's simple enough. For about 2 minutes or so, you go at a pace that now we determine these paces with the mitochondrial function analysis I was just telling you about. But given that people don't have that, basically you go at a pace where your breathing is sort of moderately intense, a pace that you say, I could probably do this for a good half an hour.
Okay.
So you go at that pace for about 2 minutes, and then you go as fast as you can humanly go for about 20, 40 seconds. Okay. The idea is after that 20 or 40 seconds, you're supposed to be pretty much spent. You're supposed to be thinking to yourself, I can't continue this pace much longer. You're going to be way out of breath, and your heart rate's going to be very, very elevated. But you only do that for 20 or 40 seconds. That's what's training your mitochondria now to utilize oxygen more efficiently. Then you slow down, really slow pace. If you're on a trampoline, you're going to just go, just maybe slowly up and down like you're walking slowly.
Okay.
And allow your breathing and your heart rate to recover. Once they've recovered, that may take 3 minutes, 4 minutes. Once they've recovered, you just keep repeating that process.
Okay. So you just do that maybe 4 or 5 times, 4 or 5 different cycles?
Yeah, exactly. I would do that like 4 times, maybe 3 times a week.
Okay.
And, that typically is enough exercise to do it. You might need some ozone therapy to give you a jump start, but typically that should get you going. But you also want to look at all of the other things that come to mind, not the least of which is toxicity. A lot of us are overburdened by our toxicity, the toxicity in the environment. And we're basically poisoned. Now, there's going to be a subset of the population who's going to be poisoned by things that doesn't poison the rest of us. It's going to be a subset of the population is going to be pretty screwed up from these vaccines, from the flu vaccine to the rest of them. There's going to be a subset of the population. The FDA has listed over 150 some odd drugs that are mitochondrial suppressants.
Really?
So the drugs that your doctor gives you, whether it's for blood pressure or diabetes or whatever they give you, some of those drugs in certain individuals are going to be a mitochondrial suppressant.
Jeez, I was just
reading. There are other things you have to pay attention to.
Yeah. I was just reading the other day about this article that was saying that there was, since the early 1960s, over 60,000 new chemicals have been introduced into our environment. 60,000 since the 60s. I mean, unbelievable, right? It's crazy.
Yeah, you detoxify yourself of these chemicals. Your body can detoxify them, but you need oxygen to do it. It's all done with peroxides. So if your mitochondria aren't cranking out the energy enough to detoxify, you are not going to detoxify. The toxins are going to start building up, and it's an ironic effect. But the least likely you can process oxygen, the more toxic you become. The more toxic you become, the least likely you can process oxygen because your mitochondria get poisoned by these toxins.
Yeah, that's a vicious cycle.
It's a vicious cycle.
Yeah. So let's talk a little bit about ozone and different ways people might consider it, because a lot of people listening might have something like some extra cells growing in their body they don't want, or maybe they have, a bad knee, or maybe they have just joint pain. Let's talk about some of the ways people can think about bringing ozone into their body, like some different methods that you use.
Yes. So now I wrote a book called The Ozone Miracle.
Okay.
They can access that on Amazon. Also, they can go to theozonmiracle.com and they can learn some stuff there too. But that's sort of a paint by numbers book that people at home can use and know how to use ozone to do their own treatments at home. And so that's one way you can learn about it. But basically, you can use it to treat the blood. You can use it as an enema. It can come in through the intestines. Yeah, there it is. Okay.
There we go. Yeah.
It can, and then that, by the way, goes straight to the liver. So that's a very good treatment for the liver. You can have it absorbed through the skin in the form of a specialized sauna that pumps ozone into the sauna box, and it gets absorbed through the skin. As I mentioned, you can put it into bladders. You can put it into a vagina if there's any kind of issues that need problem there. You can apply it to the skin. There's a sauna right there. You can apply it to a skin in the sense of a bag. So let's say you have an infection on your foot or something. You can put your foot into the bag, pump ozone into that bag. There's just you can pump it into your ears if you have a cold. You can inject it all over the place. If you're a doctor, you can inject it all over the place and get all kinds of treatments that way. And of course, you can put it in the blood.
Mm-hmm.
So there's lots of ways. If you came to my clinic, everybody's getting ozone in about 5 different ways.
Wow. And there's also ozonated oils too people can put on their skin.
Yes.
Right?
Yes. So you know who invented that?
Who?
Was Nikola Tesla.
Really?
In 1903, yeah, it's a little known fact, but Nikola Tesla was the guy that actually invented ozonated, in his case, olive oil. You bubble the ozone up through olive oil, and there's double bonds in that. Remember, the ozone's going to be attracted to those double bonds. So it's going to interact with that and form all these peroxides in that olive oil. And then you can eat that. Or take it in the form of capsules. And so you're going to get a lot of effect just from those.
Now, wouldn't the ozone have a deleterious effect on your gut bacteria, do you think?
Doesn't seem to be, because of the bacteria that are generally considered the healthy ones, the ones that really help us a lot. They synthesize vitamins and other nutrients that are important to us. Those mostly can handle ozone. They can handle the peroxides just fine.
Interesting.
It's the ones that tend to cause the disease. They cannot handle the peroxides. So it will knock some of the bacteria out, but typically only the ones that need a little knocking out anyway.
Now, am I wrong or incorrect in thinking I've heard people doing ozone, not enemas, but ozone, gosh, what's the word? Colonics? Have you heard? Is that something that's
Yeah. So we do that all the time.
Okay.
In the clinic. For anyone in the audience that doesn't know what a colonic is, basically it's a fantastic procedure, by the way. We do it in the clinic all the time, but it's a cleansing procedure. It's a detoxification procedure.
Okay.
And what it does is a tube is inserted into the rectum, and then water is pumped into the intestines and then pumped out. In and out, in and out. So as the water's irrigating out the intestines, sure enough, it's pulling all the toxins out of the body.
I see. Right.
And so while we're doing that, every second or third time the water goes in, we also pump in a lot of ozone gas. So that at the same time they're getting this detoxifying reaction, they're also getting an ozone stimulating reaction.
I see. Yeah, you know who told me about that was a friend of our show, Dr. Richard Massey, and he was telling me about how it really is like a colonic on steroids. It really is on a different level. Is that true?
Yes, I have to say that's true. Yeah.
That is so interesting. Yeah, so a lot of different ways to get an ozone or get ozone into the body. I have a machine, and I know you've done some videos with a mutual friend of ours, Marcus Freudenman, out in Australia.
Yeah.
And I have one of his machines. Unfortunately, I got his machine when my wife was going through a really challenging pregnancy, and so I haven't used it yet, but the machine, we have it, and I'm thinking about getting it out and using it, and that's something that you could do. I know he talks a lot about doing rectal installations to start with. Is that a good idea, do you think?
Yeah, so that's very simple. It's the simplest thing in the world. I give myself ozone treatments on a pretty regular basis. And I use that particular way most of the time. I also do blood treatments on myself, just as sort of a good thing to do, good preventive thing to do. But the rectal treatments are very easy to do. You don't need a doctor. You don't need to stick a needle in you. Everything's very simple. You just take a little tube, put it about 4 inches into the rectum as though you were going to give yourself an enema, which you're not actually going to do in this case. And you typically want to do it after a bowel movement. And you put the tube in there, and then you take the ozone gas and push maybe 200 cc's of that gas into the colon, pull the tube up, get up, off you go. Instantaneously, by the way, what's happened there when the ozone's gotten into that colon is it instantaneously reacts with the lipids in there, and then those lipids get absorbed via the lymph system and via the venous system and go straight to the liver and straight to the lungs and heart.
Isn't that interesting? So you want to do it after you do your regular enema, maybe, if you do a regular enema.
That would be best. Yeah. So if you're going to do an enema, do the enema first and then follow it with this.
Interesting. So with ozone therapy, I know you're on the cutting edge, and you're the doctor that teaches all the other doctors how to do all this stuff and integrate it into their practice. And I think our Dr. Nunley, learned all of his stuff from you. When you're looking at ozone therapy and things, are there interesting sort of ways that you're thinking about combining? Like, is there, can you combine it, for example, with something like UBI, which is ultraviolet blood irradiation? Can you combine it with other methods and therapies? And are you looking at those and seeing promise and doing combination kind of style treatments?
It's a good point you make. And that's a point I really like to try and drive home to everybody. And that is, ozone is one of those things, because it works on such a basic level, That's important. It's not working on some particular level. It's working on a level that involves every single solitary reaction that goes on in the human body. There's nothing that is more essential to health than oxygen metabolism. There just doesn't exist. So the reality is, no matter what therapy a patient is getting, if you add ozone therapy to it, it always just makes it better. So it combines really, really easily. We see this especially true for infections. So I'll have somebody call me up and say, I've got a bad case of MRSA, or I have an infected shoulder and nothing's responding. The antibiotics won't work. And the reality is, when they come to the clinic, we can just continue the antibiotic. But when we add ozone in there, all of a sudden it works. All of a sudden we can clear these things up.
Wow.
And this is a great example of how whatever you're doing, whether it's chemotherapy, whether you're about ready to get a stent put in, it doesn't sort of matter. Whatever treatment you're getting, it's always going to be amplified and always going to be more effective if you add in ozone therapy.
And I would imagine, you mentioned chemo, I'd imagine that chemo would be something you definitely want to use it if someone's gonna decide to do chemo, because talk about a mitochondrial destroyer, chemotherapy, right?
What we like to do is, what's especially important is when a patient is first diagnosed with a cancer that the doctor says requires chemo, the first thing we do is don't do the chemo. For 3 weeks prior to the chemo, get yourself some ozone treatments, clean yourself out, get some vitamin C, build yourself up. Then, after 3 weeks of that, then get the chemo. What's going to happen every time we do that is the patient breezes through it, doesn't develop any of the problems from the chemo, and it works so much better. And then ideally, by the way, as they're getting the chemo, to a lesser extent, but we're still continuing these kinds of things.
So you work with people, like people can come to your clinic there in Nevada and sort of go through that process with you?
Sure, yeah.
That is so cool. So have you been able to work with people with chemo and where they don't lose their hair, they don't have the energy reduction and stuff like that?
Absolutely. What comes to mind is a patient I saw the other day who has been getting chemo from one of the local oncologists and has been doing this thing that I was just telling you about, where beforehand got a series of treatments and continues to get once a week, gets an ozone treatment while they're going through the chemo process. And 1 week, for whatever reason, he couldn't make it in to get his ozone treatments. And the next week when I saw him, he says, "I'm not doing that again." He said, I got the chemo and it made me quite sick, and I haven't been sick before, but I'm not gonna miss that again. Wow. So I think it's a really important part. It actually, there's good data to substantiate that it's going to make the chemo more effective, and I can definitely tell you, it decreases the side effects very significantly.
Now, if you're someone listening to this show and you're in relatively good health, you feel great, you have energy, just an average normal guy or girl going through life, do you think it would be beneficial for someone to get on a regular ozone therapy practice? Because now I'm motivated to get my machine out and start using it, but I'm wondering, how much should I use it? I feel great. Should I just do it once or twice a month, or what's the protocol for someone, the general protocol, if you could even say?
Okay,
for someone
so
that's
I see it in basically two ways. One way is get your mitochondrial function analyzed.
Okay.
And not to do that, you're going to have to travel. There's only about 10 doctors in the whole country doing this.
Oh, wow.
So, but it seems to me that it would be a great idea to get your mitochondrial function tested. For one, to see if it's okay. It probably is, but remember those 30 to 40-year-olders, like 10% of them, it wasn't. So there's a chance that even though you're feeling good and you're relatively young, it might not be.
Okay.
But but even if it is real good, what's nice is now you got a baseline. Now you can say, it was this when I was 45 or 42. And when you get to be 62, you want it to be at least the same. You don't want it to go down.
Okay.
So it gives you a baseline. So in the sense, one sense, the best thing is just get your mitochondrial function. If it's already good, there's not a whole lot of purpose unless you're battling some particular ailment.
Okay.
There's not a lot of whole purpose on doing ozone therapy.
Interesting. What about
on
if
the other
you...
hand, if you don't do that,
Uh-huh.
then you could just do it, say, twice a week. Do a rectal insufflation just twice a week, and you can't go wrong there.
Okay.
You may not need it, but it's going to have good effects on you anyway. It's very helpful to the immune system, for example. We haven't even talked about all the many effects that it does, but one of the effects is it dramatically stimulates your immune system.
Oh, okay. So maybe if you're coming down with a flu or cold or something,
Yeah,
that could be a good idea.
So if you're a guy that maybe you're actually in pretty good shape, but you're coming down with things a little bit more often than you think is reasonable, you might find that by doing this, all of a sudden you don't.
Okay. Yeah, interesting. So if people want to come see you in your office or visit your office, I'm sure you have multiple practitioners. You guys are in Carson City, Nevada. Is that correct?
That's right. Yeah.
Okay. And how far are you? We actually go up to Lake Tahoe once a year. How far away are you from there? Yeah.
Yeah, we're right at the base of Lake Tahoe. We're like half hour away.
Oh, cool. Okay. And now do you...
So people would fly into Reno, basically.
Okay. Fly into Reno, and then they can come see you. Yeah. And then if they need to see you for a week or so, or a week or two, or you just set them up with hotels in the area or something like that?
Yeah. Mm-hmm. Yep.
Okay. Interesting. Oh, gosh. Okay, well, this is really, really cool. Doc, thank you so much for spending your time with me and sharing your work with our audience. I really appreciate this.
Well, I'm always glad to get the word out, and I appreciate guys like you, Justin, that are doing that. So thanks for having me.
Yeah, you're so welcome. I'll be in touch on email, and I'll send you the link to this video, and feel free to share it with whomever
Okay, great.
You like. Yeah, awesome. Thanks, Doc. I'll talk to you soon. Okay.
Okay. Take care.
Okay. Bye. So there you go, Mr. Dr. Frank Shallenberger. What did you guys think about him? Interesting, right? Very, very interesting stuff. And one of the things that we like to do on our show is to feature people like him who are doing some really interesting treatments that maybe, your medical doctor doesn't know about. And I find it to be very fascinating. Like, when I found him on Quack Watch, I just thought, okay, we got to have this guy on the show because, like I said before, I've known about his work for years. He's always referenced by, the top doctors in the world. And, he's the guy that teaches all the guys how to do the ozone, and he's the one that's done all the research. And so I find it really fascinating that he's on Quack Watch. And so these websites that are out there, Snopes and Quack Watch and all these things, they're designed to funnel people into a particular way of thinking, and they're designed to get you to put doubt and to put fear into people like Dr. Frank Shallenberger and other people that are doing great work. And, for a while back, I'm not sure if you guys are familiar with this, but if you are familiar with Dr. Jonathan Wright, he's up in Tahoma, Washington, I think, and he had federal agents in the mid-90s. Federal agents come to his clinic, shut everything down, burst in the door with guns, put everyone up against the wall, and confiscated his B vitamins. I mean, is something like that even real? Is that a real thing that could happen in America, land of the free, home of the brave, right? So they don't like people out there that are doing actual work that's saving people because they have a brand to protect. And that brand is chemotherapy, pharmaceutical drugs, ask your doctor, the entire medical establishment, $1 trillion business per year. So it's really important for them to protect their brand. And I get that. It's all business. It's all capitalism. I get it all. But what they don't want is empowered people like you realizing, hey, next time, like let's say I ever get a snake bite or I get staph or I get some sort of infection, diabetic neuropathy, things like that. If I can actually buy an ozone generator myself and treat myself, or I can drive to a place like his clinic in Carson City, and I can overcome this without pharmaceutical drugs and actually ever even going to a doctor, it's not beneficial for them to have a patient population that can do those things. And that's part of the reason why I wanted to feature him. We've done a few shows on ozone. I think we talked to, it's hard to remember now, 650 some odd shows. But I know Marcus, we talked with him about ozone therapy, and we promote him and his products. But to be able to be an empowered patient, I think is one of the most important things that we could all do for our health. And sometimes it's not necessarily even like, I want to do all this stuff myself. It's just educating yourself and to the extent that something exists, right? So if you know something exists, I didn't want to ask Dr. Shallenberger on the show this question because I know a lot of people are using ozone therapy in place of chemo. And that's part of the reason why you see this thing with cannabis. Like they'd say, oh, if you're going to have chemotherapy, make sure you take cannabis with your chemo because cannabis will actually help make chemo work better. Grab my headset here, but and so it's one of those things where they want to make you think that cannabis and ozone and these types of things are there so that you will continue to take the traditional treatment, the medical treatment, namely chemotherapy, radiation, but this will just help it, and I didn't want to put Dr. Shallenberger on the spot because, I don't want to speak for him and I don't want to get him in trouble with anything, but it's really important for all of us to understand what's out there and what's available for us. And I think it's just absolutely critical to understand that. And so I just think that, I love featuring guys like this on our show so that we can, all of us, fully understand what's happening and what's going on. And so I wanted to tell you guys, talking about mitochondrial function, and one of the things that we're talking about on the show is, exercising to increase mitochondrial function. But there's a really fascinating new technology that is tremendous for boosting mitochondrial health. It's basically pure food for the mitochondria, and it's called red light therapy, and we use a product called the Juve. And here's a little excerpt, a few minute excerpt of a conversation I had with Nathan Walls, who talked about pure mitochondrial function and red light therapy and how that all ties together. So this is a couple minutes long, but check this out from Nathan Walls.
So red light actually penetrates your skin much deeper.
Okay.
Red light can penetrate up to 30 centimeters.
Oh, wow.
So it doesn't penetrate as deeply into bone, but if you have, fat or muscle, it penetrates pretty deeply into that. So blue light, it doesn't penetrate as deeply, but it's the highest energy frequency of light in the visible spectrum. And, blue light is in the sun too. So blue light is not a bad thing in nature, because when you get blue light from the sun, it's balanced with these other colors of light. And red light is very regenerative. And that's why I'm sure you've had people on your show, Justin, that talk about photobiomodulation or low-level light therapy, using specific frequencies of red light to regenerate your skin or to speed up muscle recovery. It's very big in professional sports. It's big. A lot of vets are using it now too. I think I hear about more vets using it on animals than doctors using it on humans. But beauticians use it. It's really good for your skin. Some places women go to for, get a haircut, they'll put them in front of like a red light thing in their face because it's good for their skin too. Yeah, it'll also increase your testosterone production too. This might be TMI for some people, so cover your ears. But in the summer, the sun rises right into my apartment, and so I open my door and I'm butt naked in the morning for the sunrise. I'm doing my meditation. But that increases your testosterone for sure, and that's also going to help with prostate. But for prostate, in addition to red light, you do want to be getting some UV light too, so you can increase your local melatonin there. But if you can't get outside and do it, then red light will offer a benefit too. So some of the key spectrums of light that people use red light therapy for is 660 nanometers, and that's going to be really good. Let's say you have you work out and your muscles are really sore, that's going to help with muscle recovery. That's pretty good for your skin, and you can use that, on your skin, or you can use it for muscle recovery. But if you use it for 15 to 20 increments, you can get a benefit from that. So 660 is a big one. 850 nanometers, which is more infrared, that has other benefits. I think 850 is more for brain. So they're using, and if you want to search this more, you can look up LLLT, which is low-level light therapy or low-level laser therapy, or photobiomodulation. And one of the top researchers on photobiomodulation But if you look at, if you Google LLLT Hamblin Harvard, he's got some very kind of concise, easy to read articles, and he has this one, like an image of a human, and it goes through, it talks about all the different things that they're using red light for.
Wow.
Such as, muscle recover, neurodegeneration. If you have a sluggish liver, you can put it on your liver, and it'll improve your liver. Because remember, red light penetrates up to 30 centimeters into your body, and red light can turn that ATPase. So those photons from the red light can literally go in your cells, in your mitochondria, and make ATP. They can make energy. So and the way this works is, your red blood cells. What's really interesting is if you blow up a red blood cell, it's kind of shaped like a donut, but it's kind of shaped like a satellite, or like a dish. Why are dishes shaped like that? So they can capture the signal. So your red blood cells are shaped in a certain way so they can capture photons of light, capture that light, and then they take it to your cells, and your mitochondria can use that to make energy. So that's another thing, using red light also improves your mitochondrial function. So it has all sorts of benefits, but if you really want to dig into it, just kind of Google the terms I told you, and you'll find a whole lot of information on the internet.
Yeah, big fan of red light therapy. Nathan, thanks for that little clip. That was a little clip that we did from with Nathan Walls from a while back, but great guy, and big fan of these Juve red light therapy devices. And that's the one that we use. If you follow us on Instagram, you probably see us standing in front of that crazy, wacky thing. And it's a lot of fun. There's a picture. Here's a picture of me. You guys want to see a photo of me standing in front of mine. You can probably see it here. I'll bring it up on screen, but it is one of those things I wanted to talk about in today's show because it does have a direct impact on mitochondrial function. And here I am standing in front of it. And this is how I do my treatments. I do, I probably do about 10 minutes per day. And that's my general thing. And I usually I stack different therapies. So I'll stand there and I'll do, like the SOTA device, which is a PEMF, localized PEMF device, and I'll run that over my liver and over my chest and things, and my neck, my thyroid while I'm doing this, or I'll do the rapid release while I do this as well. And so a lot of really cool things that you can do, and there's so many different ways to help the body heal and restore and to regenerate and improve mitochondrial function that you can't do one thing for at a time. You have to stack these things because there's just literally so many different things that you can do, which is cool. But if you do them, you're going to end up doing them all day long, all day, every day, and that's going to be just take up your entire day. So. And then the other thing I wanted to tell you guys about, and just really stress with you guys, is do your best. During today's show, we're talking about lifestyle habits, and here's a little thing about me and my lifestyle habits. I have a really bad habit, I will say, of going to bed very late. This is one of the things that I am not good at, and I'm always working on getting to bed earlier and earlier and earlier. And when Dr. Shallenberger said earlier, in today's show about going to bed at 2 a.m, sometimes I do that because, I work from home and I produce the shows and I work, getting new guests and always working. And a lot of times, our kids, I can't work during the day. And so that bleeds into the evening. So that's something I'm working on. But improving your sleep, guys, is one of the things that we should all be doing. We should all be working on optimizing our sleep. It's so critical. And one of the best ways to do that, there's lots of different ways to improving your sleep, from mitigating EMF and wireless radiation, but sleeping in a magnetic field. I don't know if you guys are familiar with, magnets and how they impact your health, but let me play this little clip from Jason Prawl, and he talks about this as well.
I just heard those devices that you had during the break, by the way, and I actually want to add to that because that's really cool stuff. I actually have the Magnetico sleep pad myself. I've got the 20 Gauss. It actually is really important. And what's happening is with the Earth, according to research and some pretty good science, that the poles are actually wandering. Instead of being sort of perfectly aligned and opposite of each other, there's multiple poles on the north and south, and they're actually wandering around. And basically what that does is it decreases magnetism around the Earth, but it does so in an uneven way, in an undistributed way. So it's not exactly uniform around the planet. What's happening is we are getting extra solar energies coming to the Earth. So we're actually seeing like UVC is now increasing on the planet. because of our magnetic field. Our magnetic shield is not as protective. So it's really interesting stuff what's happening as we're moving into new parts of the galaxy, and we're getting new energies, and all this stuff is changing. So I actually have a magnetico sleep pad.
Yeah, Jason Peral's a cool guy. He's down in San Diego. He runs the Human Longevity Project, which is a really great documentary, and we talked a little bit about this. But, he sort of one-upped us because we only have the 10 Gauss Magnetico sleep system. We're going to be upgrading very, very soon to the 20 Gauss. And this thing is like, it's got 1,200 magnets in one mattress, and I think it weighs like 75 pounds. And this is a significant investment. But what the cool thing about magnetism is that after 50 years of having this Magnetico sleep pad, it only decreases its magnetic output by 6%. So it's really, really a cool investment in your health. And, sleeping in a magnetic field has been one of the reasons why we all just sleep so good. Our kids sleep for like 12 hours a night still. They started doing this at 5 weeks old. Crazy. And I love it too, because what it does is it helps. It does a lot of things, but it helps your ATP and your mitochondria and the electrons spin faster and create more energy in your body and more ATP. And but it does so many other things too. I like it because 5G is coming, and one of my mitigation strategies is to sleep in a magnetic field in order to offset dirty electricity in the house, dirty electricity in the walls that are causing all kinds of health issues, and 5G as well. So if we can spend 8 to 10 hours a night sleeping, even if it's 6 hours, sleeping in a magnetic field, I'm telling you guys, it's one of the best things for your health. So let me take a look here. I think they offer a 10% discount. Yeah. So if you guys are interested in the Magnetico sleep pad, enter the code EHR10 and you'll save 10%. I just want to let you guys know that so that you can get a 10% discount if you're interested in that. And also the Juve, make sure to check that out as well. But curious what you guys think about Dr. Frank Shallenberger. Really, really cool guy, right? I'm really a fan of his work and what he's doing, providing help and inspiration for people. And it's really, really cool. And I'm curious, I'll spend a couple minutes here before I go. Let's see here, reading some of your comments in the chat room. This is my favorite part of being on this show and doing a live show, is that I get to hang out with you guys. Angie. Oh, Chris says, oh, my bad, Chris. I didn't see your question until just now. I really apologize in all caps. Does Frank recommend the same for immunotherapy as for chemo, the same protocol? Gosh, Chris, I apologize. I should have looked at your question during the show. It's really challenging when I'm doing the shows because there's so many good questions that come in from the chat room, but I'm also trying to not jump around too much because I know guests don't like to jump around a lot. But I also want to make sure I ask the questions that you guys are actually asking. So, Chris, I apologize for not asking this question. But I would recommend going to his website. I think it's antiagingmedicine.com, and you can ask them immunotherapy as for chemo, the same protocol. I love Rod Soar. Stop geoengineering. Please. If we could put in a request from the general populace, we would all love for geoengineering to stop. I think we could all agree on that, right? Jay Steele says, does a regular trampoline work just as well? Yeah, it does. Any way that you can jump up and down is really going to be helpful for your health. And I can tell you just from my own personal experience, I was doing jiu-jitsu, from 2005 to 2008. And one night I was helping a guy train for a tournament, and I tore my ACL. And at that time I was doing rebounding because I just learned about it. And a problem with my knee at all. It's tricky because you want to put as much force load as you can on your muscles without and decreasing the amount of force and output that you're putting on your joints. So ideally, you'd want to be able to, through exercise, through strength training, to put as much force on as you can on your actual muscles, but zero on your joints. The problem is that in order to work your muscles, you have to move your joints. So that's the issue. That's the rub there. So just make sure that whenever you're doing something as far as exercise goes, you're protecting your joints. I know some of the other rebounders are, there's more impact on your joints. So make sure if you're going to do something for a lot of years that your joints are protected. I'm just a fan of the Bellicon myself. because of that. And I also like the fact that it uses those flexi ropes. I think that's really cool because, you know, I can do it next to our bedroom and the kids don't wake up. And so that's really a big plus for me. Plus you can fold it, you know, and put it underneath the bed and things like that. So we're getting some more ropes here today. Actually, I'm really excited about that. Do you have any experience treating smoldering multiple myelemia, elevated lambda free light chains, and could it help balance or reverse the progression? Wow. Gosh, Ivy Parsons, I'm not sure about that. Angie says, my dad, Robert, reluctantly went to hospital Tuesday night. I was having a hard time listening to all this. I'm having a hard time. He's had a cough when he gets worked up for decades, and he's been Agent Oranged, I do know, but he has what seemed like pneumonia for the past few weeks, losing weight. He resists the doctors, always wanting to be for others and never using resources. Yeah, Angie, you know, maybe he might be a good candidate for some ozone therapy, you know? You don't know. Gosh, keep us up to date. Callie says, big pharmaceutical companies wants to use cannabis for cancer treatment. I heard then they try to mimic it, and people sadly died and injured. Yeah, it's you know, it's a war of information out there, most definitely, and it's really important to understand that a lot of these treatments can be used in place of chemotherapy. You know, so it's really important. Thank you, Angie, for your comments. I appreciate that, and best of luck to your dad too. Let me know what happens, and email me too if you need any assistance. Might be able to help with some things. Rain Country says, coming in late, so this may have already been said, but does the red light also help with the eyes to counteract the blue light exposure? It definitely does, Rain Country. Definitely does. So the balancing frequency to blue is red and purple. And so if you're getting excessive amounts of blue light, then you want to make sure that you bring in the red to balance that out, because it's really important. If you have too much blue, you're going to be causing a cascading effects on your health, on your mitochondrial function, your DHA production. It's really, really damaging. So that's why it's really important. The best light you can get is not a Juve red light therapy. The best light you can get is actual sunlight, because sunlight is timed perfectly with your own mitochondria. And so your mitochondria know what time of day it is. They know what temperature it is. They know where on the earth you're living. The mitochondria sends out these signals all the time to figure out what kind of environment you're in and create ATP and energy so that the cells can replicate correctly for where you are on the earth. And so that's why the sun, it's really important to go out and get sun as much as you possibly can every day to reset. It's like resetting a clock. You know, if you have two clocks and you set them identical and then you leave them for 20 years and come back, they're going to be way off, right? But if you reset them once a month, they're going to be completely accurate 20 years down the line, because you keep resetting it. And that's what it's like going out into the sun, getting into the environment, and living your life close to nature, is you're constantly resetting yourself. So your mitochondria know how to operate and how to create cells and how not to create free radicals and all this stuff. So when you reset yourself with actual biophotons from the sun, it's the best thing that you could ever do for your health. The problem is that a lot of people can't get out in the sun, especially in the winter months, and that's why I like the Juve. It's not a replacement for the sun. Nothing can replace the sun, but it's good to have on hand and to use. I use it every single day, because the way I look at it is I'm being exposed to blue light as much as I am, and I'm protecting my thyroid here. You may not be able to see. I have blue light glasses on. I have a long sleeve shirt by design, but I'm also making sure that no matter how much blue light exposure I'm getting, I'm also getting equal amounts of sun. And if I can't do that, then I use the red light. So I use the red light actually just every day, just as a way of mitigation strategies. So I think that's it. Miss Vicky says, awesome. I had to be here for this show. Great show, Justin. Well, thank you, Vicky. I appreciate that a lot. Brown Box says, yeah, I liked him. Heard lots of stuff on ozone. Nice to finally hear explanations how it works. Good stuff. Thanks for doing what you do. Yeah, I appreciate that. I really appreciate that a lot, because when you understand why you're taking a certain herb or you're doing a certain treatment, if you know why you're doing red light therapy, or why you're trying to increase your bone density by doing rebounding. You know why you're doing the green smoothies and green juices and living a healthy life. If you have a reason as to at least a basic understanding as to what's going on in your body and why you're doing it, it helps that process become more effective in your life. Understanding the why is really critical. And also understanding the why is really critical too, because when you're trying to take care of yourself, I don't know about you guys, but this is how I feel. Like, you have so many things pulling at you, right? Like for us, we have our Extreme Health Academy that we run. We have the radio show, scheduling guests. We have people helping us. We have a full-time thing at our house with our 2 kids, trying to keep everybody happy. And sometimes you lose the motivation or you lose the desire to do a particular treatment. So last night I got in my sauna at 10:30 at night because I understand what it does, and I understand that we just had a 5G tower installed in our neighborhood. Okay, so now I can't be as lazy with my self-care routines because we have now a new stressor in our life, and that's a 5G tower next to our neighborhood, which is causing all kinds of problems, right? So now I know that the sauna pulls heavy metals and toxins out of the body. It allows the mitochondria to work properly. It helps to detoxify fat cells and pull all that stuff out of the body. It helps to increase circulation. It helps to increase your immune system, right? So the fact that I know all this, and the fact that I'm looking at my life and my environment saying, okay, we have now a new stressor. Maybe the new stressor for you is a new job, or the new stressor is the birth of a child, or the new stressor is I just took on a car payment and I'm not sure how I can pay for that, or the new stressor is I'm in a new relationship, or I'm stressed about getting married. Maybe the new stressor is I'm trying to get out of a job that I don't like. And so we have all these stressors, and some of them are brand new in our life. And so the more new stressors you have in your life, the more you have to do for your self-care and mitigation strategies in order to live a healthy, long life. So you got to look at your life and look at your stressors and see what's coming at you and realize, okay, now I need to start doing more. And so like last night, it was really important for me to do the sauna, even though it was 10:30 at night, because I know I have this new stress in my life, which is that 5G tower. And we're doing some things to mitigate that, which I can talk about in a different show. But what I was just saying about having a motivation, some days you might be motivated to work out. For example, if you're going to do a workout, just because you want to look good in a bathing suit coming up this summer, right? Some days you may want to work out because you know that by working out, you improve your mitochondrial function. Some days you just want to work out just to get away from the kids. Some day you want to work out just because it gives you a chance, if you listen to music or podcasts, a chance to listen to your favorite podcast. Some days you want to work out maybe because if you have, like me, your workout in the backyard, you want to get the sunshine. So your desire to work out might be so low, but it's not low enough to trump one of those 5 different motivating factors. So having multiple factors for the reasons behind you doing what you do, in my opinion, is super important because, one day it may be option 1, another day it might be option 2, but if you only have one thing that motivates you for doing a self-care routine like a sauna or like working out, if that particular thing doesn't motivate you that day, then you probably won't do it. And so having a real understanding as to why you're doing ozone therapy, or why you're doing red light therapy, or why you're doing sauna therapy, or why you're doing rebounding, like all of these things, having a why behind them is so important. So, that's my little rant on that. Is red light therapy on your thyroid? Yeah, like Nathan was saying during that little commercial, red light, or your thyroid sits right below your skin. And so that's one of the things that I do with the red light is I open my mouth and I get the red light into my teeth because it helps build collagen production and it helps regenerate tissue. And it penetrates 10 to 30 centimeters into the body. And so that's why it's really great for your liver or your internal organs as well, but particularly your thyroid. And if you are not blocking your thyroid from blue light during the day, you're definitely going to want to get at least the sunlight, or I should say preferably the sunlight, or at least a red light therapy device like the Juve to penetrate your thyroid. Super important. People, you can do a whole You can go through the whole thyroid summits and they're not talking about blue light on your thyroid. And so it's just crazy that people just miss that piece altogether. Mark is listening from Holland. I saw Oscar, I think you're in Spain, right? And Mark from Holland, great to see you guys. Sam, is there any way to differentiate who is a good candidate for IV vitamin C versus ozone as they neutralize each other? What about you guys? Do you guys have any thoughts on that? Is there a way to differentiate a good candidate for IV vitamin C therapy? Sam, if I were you, if this is you're talking about, I would probably just do both different times of the day or different days of the week. That's what I would do. I'm not sure if you caught this little piece that Frank was talking about, but at his clinic at Anti-Aging Medicine there in Carson City, Nevada, they actually do, they do the high-dose vitamin C and the high-dose glutathione right after the ozone treatment. So if my memory is correct on this show, it sounds to me like when the ozone enters the body, that third molecule creates lipoperoxide in the body, lipoperoxides. And once those get created, and they get created instantly, according to Frank. And so once they get created, then you can bring in the antioxidants. And he said on the show that it's actually showing that it improves the results that they're getting from the ozone. But you just don't want to do the antioxidants before the ozone treatment. You might have to go back and look at what he said. It was somewhere around the middle of the show. But yeah, something to consider. If you feel particularly drawn to do it, I would do it. We like the ozone machines. We sell, I don't even know if they're available in our store yet, but they're through Marcus Freudenman. And you can go to our store and you can click, I know his sauna's in our store. And we're going to be putting some of his other products in our store as well. But if you just click over from the sauna product in our store, you can click over and then navigate over to the ozone machine, and that's the one that we have. And we're going to start using that. I'm motivated now, so that's good. Things are settling down a little bit with the kids. We're getting into a little bit of a routine. There's a little bit of spare time every now and then, so it's cool. And I think if you are feeling particularly pulled to a certain therapy, I believe that it's your body telling you need that. We just disconnect ourselves so much from our body and from our subconscious and from our mind, and the deepest part of ourselves. We disconnect from that, so we don't know what we really need. But I feel like if you are drawn to coffee enemas, maybe you have an issue going on with your liver that you need to be working on, for example. So Oscar says, I wonder if breathing like the Wim Hof or other modalities in yoga can fill your body with the same amounts. Yes, you know what? We did a really good show. You probably heard it with, gosh, what is his name? He's the guy, I think he's in Spain, and he does the Budwiq method of breathing. One thing I would recommend for all of us is to get some tape that you can tape over your mouth so that you can breathe in more oxygen while you're sleeping and not breathe through your mouth. Breathing through your mouth is one of the most dangerous and one of the most unhealthy things that you could ever do. And you'd never think that, right? You'd never think that breathing through your mouth, it affects myofascial, facial structures of children. It affects the actual gases in your blood. And so breathing through your mouth is really dangerous. And so if we can learn to breathe through our nose and the Budwiq method, it's going to impact our health a lot. So one of the things I've been doing a lot is just reminding myself often, if I'm home by myself or if I'm not talking like this, by myself, I can just breathe through my nose and keep that as a constant practice. Super, super important. But yeah. Okay, so cool questions. Sam says, I heard that he mentioned it, cannot afford both, so I was wondering if any one is good. So yeah, I would just do whichever one is cheaper for you right now, and then maybe save up for the other one. Cost is an issue with a lot of these things. The device that we have, I think he sells it. Marcus sells it for about $1,000, $1,200 or something, and that's the typical rate for an ozone generator, ozone machine that you would buy at home. And so, but I'm telling you guys, like these things, these devices that you can get at your home, I'm not saying that you need them to be healthy, because none of these things create health. Health is a much deeper pursuit, and it's multiple layers. But what these devices can do is speed up the process. And I'm really a big fan of bringing these types of devices into your home, like an ozone machine, and learning how to use it. That's one thing that I am speaking to myself here. I need to learn how to use that thing. And once I learn how to use it, I'll be sharing some YouTube videos on how it's done and how we use it. But bringing the red light, bringing a good blender into your home, a good juicer, learning how to work with medicinal mushrooms, get, all these things, blue light blocking glasses, learning how to use those and why you should use those and things like that. So really important to bring these things into your life and lifestyle. So Yvonne says, I've had bad knees and suffer with anxieties. Can ozone help? Yeah, I'm not sure if you caught Yvonne from earlier, but I had an 80% tear in my right knee ACL, and I had ozone therapy on it, and I never had surgery. Here's one of the things that's an issue with surgery, specifically like knee surgeries, is with knee surgeries, they want to bring in a compound that's not biologically tested. So, for example, if you go to a biological dentist, they should be doing blood work and testing different composite materials that they're going to use with your own blood, and they see how your blood reacts. The problem with surgeons is they don't do any of that testing. The good thing with dentistry is that you can go to a biological dentist. You can't go to a biological surgeon, unfortunately, unless the surgeon is sort of awakened to these ideas, which hopefully doing more shows like this allows that to happen. Theoretically, they should be doing testing on the materials they're going to be putting into your body. So with a knee surgery, for me, there's two issues. There's the actual tendon that they're going to use, and then there's the actual way they're going to implant that tendon into the bone. So with me, I was going to go with a cadaver. I was going to go with my own tendon, because I don't want the tendon of a cadaver. I don't want to bring in that energy, that frequency, and that different DNA into my body in case my body doesn't recognize it. Your immune system is always going to be looking at whatever you have implanted in your body, whether it's a tattoo, whether it's a piercing, whether it's a metal plate of some kind. It's going to be looking at that as a foreign object, and your immune system is always going to be on. So that was one issue. But then I figured, okay, I'll get my own tendon, but that requires multiple cuts of the body, and I didn't want to do that. Second issue is how they're going to attach that tendon to the bone. And typically what they do is they use metal. And whenever you're going to use metal inside the body, whether it's stainless steel, whatever material they're going to use, it's not a biological material. And so that's a real issue. So now you have the tendon. If you're using your own, that's better and ideal, but then you have to deal with 2 scars and 2 meridian points you have to work on post-surgery, 2 different issues. But then if you use a cadaver tendon, you're using someone else's DNA. Then you're implanting it attaching it with metal. So those are 2 things I didn't want to do, and that's why I got Prolozone in my knee. There's other things you could do too. There's stem cells. You can look into that. That's really, really great. You can use something called Regenokine, which is a PRP plasma that they spin. They extract your blood, and then they re-inject that back in, and it helps your body to regrow tendons and tissues. A lot of the top athletes are getting that. That's Regenokine, K-I-N, I think, at the end. So there's a lot of different things you can do for joints and things like that. And that's not counting all the different dietary things, different energy practices, PEMF devices, and things like that. So there's a lot of things you can do for your joints. But cleaning up your blood is going to be huge there too. So we did a whole show with Dr. Darren Schmidt a couple months ago. It's not even on our iTunes feed yet, but it's all about lactic acidosis and how to clean up your blood, which is huge for transporting oxygen and all of that. So there's that piece as well. So a lot of cool things you can do. Rain Country says, another thing I'd recommend, especially if you are menopausal, is eggshells. I take a tablespoon of powdered eggshells daily, and they have worked wonders for me. Interesting. Wonder if that has to do with the calcium. I've heard people doing that before. They powder up the eggshells, just clean them off and powder them up, and there you go. You're off and running. Oscar says, I had my 2 knees operated because of torn cruciate ligaments. Soccer's to blame. Oh, man, soccer's tough on your knees. Yeah, people come in and they try to steal the ball and they slide, and then your knees just buckle. I had a friend that was playing soccer, and check this out. He was playing soccer, and he went up for a header. Him and his opponent went up for a header. They both jumped at the same time, and because they both jumped, they collided midair, and so that prevented my friend's body from rotating properly. And so when he landed, his knees and his legs kept rotating, but his top part of his body didn't. And so if you can imagine, he just basically, if you just like, his whole knee just buckled and just rotated 100% all the way around. And so he had a torn ACL, torn meniscus, torn MCL. He had a torn everything. So soccer's tough, man. Soccer is tough. Yeah. The eggshells, the calcium and magnesium in the eggshells. Your hot flashes came to a near stop when I started taking the eggshells. Wow, that's really cool. Something for people to know. Thanks, Rain, for sharing that. That's cool. Very, very cool. Thank you, guys. Yeah, Yvonne, I hope we helped you out with some ideas for surgery. There's also, we're going to do I'm going to do a whole thing in our academy for surgery, because there's so many different things you can do for surgeries if you're going to get one, to mitigate a lot of the damage that's caused by the anesthesia and what that does. And there's a lot of things you can do to optimize to surgeries. So I'm going to do a whole video, I think, inside our academy on surgery sort of mitigation protocols, and I think that would be helpful for people, because I've had a couple surgeries myself, and I wish I had known some of this stuff I know now back then. And Oscar, you're probably thinking the same thing. All right, guys. Well, I think I'm going to head out here. Thank you guys so much for being here today. On Monday we have Dave Feldman. That's going to be about cholesterol and the low carb diet. So if you guys have anyone in your life that has, quote, high cholesterol, and are scared about that, make sure to tune in on Monday for the live show. And then Wednesday, Dr. Ibrahim Jaffe, medical spiritual healing. And then Friday next week, Brendan Marotta. We're going to talk about his documentary called American Circumcision. That's crazy, right? American Circumcision. That's going to be a cool show. So stay tuned. Make sure to subscribe. There's a little bell button somewhere below this. I'm assuming most of you guys are probably watching on like a phone or something. But if you see a little bell to get notified when we go live, it's always fun, much more fun when you guys are here. I love chatting with you guys in the chat room. I actually am very protective about it. And I don't want more people in the chat room because you guys are all so cool. And, YouTube, you guys probably seen the comments people get on YouTube. And there's just a lot of people saying weird stuff and, not being nice. And, for some reason I've attracted, an amazing YouTube audience and YouTube live chat show audience. And you guys are just so cool. And I don't want to mess it up with, people saying negative things and trying to argue with people and all that. So I love you guys so much. It's so much fun to be here. Thank you guys for your support. Really tremendous support. I really appreciate that so much. I cannot tell you how much I appreciate your support. If you're wondering how to support the show, there's a couple different ways to do that. And I'll just, tell you guys. If you go to our homepage, you can see it here. If you scroll all the way down, there's a couple cool ways that you can support the show. And that is, you can become a patron. And a Patreon is something, it's a cool little thing that there's like a third-party service. And you click on that, and you can donate $1 per show, 50 cents per show. We do 12 shows a week, or 12 shows a month. So once a month, it'll come out of your account. And you can just donate like 25 cents a show, and so that's what, $4 a month or something, or $1 a show, and that's $12 a month, and you can just have this come out of your account. And that's a really great way to support the show. And then another way to support the show too is if I scroll down here, down below our little player box, you can see a link for Amazon. And those of you that support our show by clicking on this link before you make an Amazon purchase, I really appreciate it because we get a little commission. It's not much. We don't get much from it, but every little bit helps keep the show free. Our hosting just went out today, and $189 for hosting the website. And so these costs add up. And so when you go through our link like this and think about us before you shop on Amazon, that really, really is helpful. You wouldn't think so, but every little bit adds up, and so it really helps us a lot. So I appreciate your ongoing support over the years. And then finally, some of the products in our store you can probably see on the YouTube channel now. The sauna, we've got the Biomat, the Magnetico, the IMRS mat, which is the PEMF device, and the rapid release. All these things we use and just support and love these things. So if you guys are interested in any cutting edge products, make sure to go to our store. There's links for that at the top of our website as well as in the middle of our homepage. The raw dog food, blue blocking glasses, the Berkey water filter. This is the Omica RO water filtration system we use below our sink. So a lot of cool stuff. And then finally, guys, the best way to support the show is join our academy. That's the best way. And for that, you guys are going to get access to so much material, it'll just blow your mind. And you're going to get access to myself and Michael Bergman and my wife Kate, and we're in the forums just about every single day, interacting and sharing protocols and mitigation strategies and tips and ideas. There's thousands of people in there, and we're all helping each other and taking our health to new levels. So if you guys are interested in doing that, there's a link below this video for the Extreme Health Academy, and there's a coupon code to save on a free 14-day trial, so you guys can check that out. The course that we're going to be releasing pretty soon is all about liver health. And as you can probably imagine and understand, the liver is the most important organ in your body, which is why it regenerates, right? It's one of the only organs that regenerates. And so liver health is so critical for our health these days, so massive. We have to have a properly functioning liver. And we did a whole course on that, and that's going to be here pretty soon. So that's coming inside the Extreme Health Academy. And I hope you guys are doing good. Sam, great to see you here. Wade, Corpy, good to see you. Oscar, always good to see you, man. All the way from Spain. And Vicky, Rain Country, it's great to see you here. I've seen you here recently quite a bit, and it's really cool. I love seeing you here. Yvonne, Sam, Rebecca from the Academy, Beck in the forums. Always great to see you here as well. Linda Clark, Mark Vaught from Holland, great to see you here. So many amazing people. Andrea, Angie, Callie, I love you guys. So thanks for chiming in, asking questions, and helping each other. All right, I think that's about it, my friends. I'm going to go head out and go home and have some breakfast. Been doing some fasting, so it's time to eat. And I love you very, very much. I will see you on Monday morning at 10:45. We'll talk about cholesterol, talk about low-carb diets, and all that fun stuff. So thank you guys all. You're amazing. We love you, and I'll see you on Monday, 10:45 a.m. Pacific. Make sure to subscribe on iTunes, too. We're releasing a show a day on iTunes, 2 to 3 new shows per week, and then every other day, it's our best of content. So every day, if you're interested in the work that we do, listen and subscribe on iTunes. It's awesome. It's awesome. And you'll get a show every single day. So just want to make you aware of that. Also, make sure to follow us on Instagram. Do a lot of cool things on Instagram, too. Love connecting with you guys on there. All right, guys. Love you very, very much. And we'll see you on Monday, 10:45 a.m. Pacific time. Have a great weekend, and I'll talk to you soon. Bye-bye.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse.